All right. Good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for December 11th, 2024. My name is Julia Gruss. I am a research project coordinator at KU's Center for Public Partnerships and Research, and I will be your webinar facilitator for today. I also have my colleague, Brianna Houston, who will be monitoring the chat throughout today's presentations and making sure to put any relevant links into the chat. So if you see a link on the slides, that will be in the chat shortly thereafter. Real quick, just a couple of updates for you before we get started. Obviously, 2024 is coming to an end, and we will have the 2025 webinar series to get onto your calendars. So if you were here around this time last year, it's going to be the same situation. After today's webinar, I am going to make sure that we update all of those, all of the Zoom series and make sure that all of our 2025 webinars are added. And then I will be resending out confirmation emails. So that confirmation email will arrive to you from Zoom with the subject line KS Early Childhood Systems Building Webinar 2025 confirmation. And then from there, you should be able to add it to your calendar, and all of those dates that you see on the right side of your screen will be added onto your calendar. As you can see, we are taking January off. Just wanted to give everybody some time to just recoup from the holidays and just give everybody a free month in January. If you do not receive that email from Zoom within like the next 24 hours, I would say make sure you check your spam folder. And if it's not there, you can send me an email at jgruss@ku.edu. As always, please remember to sign up to receive our All In for Kansas Kids e-newsletter. You can do so on the Children's Cabinet website at www.kschildrenscabinet.org. You will get updates weekly, and they always have systems updates and funding opportunities, all of that good stuff. So make sure to sign up for that e-newsletter. Today, we have a presentation on the accomplishments of 2024, taking the annual cabinet report and kind of pulling out the different projects that have affected communities in Kansas and all of the hard work that has been done by Kansans throughout the year. So we are joined by Melissa Rooker, the Executive Director of the Kansas Children's Cabinet and Trust Fund, as well as Owen Cox, who is a senior researcher at KU's Center for Public Partnerships and Research. So I will pass it off to Melissa to get us started. Thank you so much for being here, Melissa.
Thanks, Julia. It is my pleasure to join you all on the webinar today. I don't often get the chance to actually sit in and join you in these discussions, so it's a pleasure to be able to say thank you to all of you for all of the work that you all have been engaged in that contributes to the early childhood ecosystem in Kansas. It's a super important mission of ours to make sure that we are working in alignment with each other, gathering information from all of you in the field that informs the work that we do on a daily basis. And just know that we are all pulling in the same direction to make sure that families and their children have access to the services they need, that services are the good quality we want them to be, and that we are all measuring the impact that we have together so that we can tell the story of the importance of investment in early childhood care and education. It's generous to say that I'm going to help with this presentation. I'm just coming off a couple of weeks off. I lost my dad over Thanksgiving. So I'm going to just introduce Owen Cox from KU and trust that Owen has command of the presentation and can share news about all the work that we've been engaged in at the cabinet level. And I'll stick around in case there are questions that I can help answer at the appropriate time. Owen?
Awesome. Thank you so much, Melissa. Thank you, Julia. I do want to do just a quick reframe here because we are going to be talking about the Children's Cabinet Annual Report. But as you see on that slide there, this really is about some highlights from that annual report. It is a much larger document than we'll go over here today, but I really did want to go in and highlight some of the community-driven programs. I will give an additional caveat to those community-driven programs. I've only selected a few. The cabinet is involved in a whole bunch of different initiatives across the state, but I must admit, have selfishly pulled out a few that I am more familiar with. And so those are the ones that we're going to dive a little bit deeper in today. I do want to make sure that I give my colleague who actually gave a full presentation on the annual report last week, Dr. Jessica Sprague Jones. That is a recording of that presentation is now available on the cabinet's website. I don't have a handy link ready for you here today, but if you go to that website and you look at the meetings, if you go to the December 2024 meeting, you can find a full recording of that presentation if you're so interested. The full report itself will be released at some point in a not too distant future. We're making some, I believe, final adjustments based on the conversation that was had at that last Children's Cabinet. And so those will be incorporated, and then at some point that will be posted to the Children's Cabinet's website as well. So you can get the entirety of the document, see all the great work that has happened at the Cabinet over the course of 2024, and maybe get ready a little bit for what's going to happen in 2025 as well. All right. I want to make sure again that how I couch this is that we are really here to, yes, dive into a couple elements of the annual report, but also really to celebrate the work that's happened at the community level. All of the stuff that we're going to talk about here today, the programs and initiatives, none of that work gets done without the sort of community-driven approach to these particular projects. So I really want to make sure that we're thinking this through as kind of in some sense, a celebration of all the work that many of you on this webinar have done throughout the course of 2024. All right, Julie, if you wouldn't mind advancing one slide for me.
Yes, and thank you. And I just wanted to make note that the link to that Children's Cabinet meeting, I actually pulled that and Bria's put that in the chat. So that has been linked if anybody is interested in going to watch that full annual report.
Fantastic. Thank you, Julia. I am nothing if not always amazed at our support that we have on these webinars and meetings to be able to drop in links just as I say them out of nowhere. All right. This first slide here really is to sort of it's in the annual report, and it really is to sort of frame the various roles that the Children's Cabinet plays in the state. And so, as you can see on your screen, there's 5 main roles that we sort of put out there as what the Children's Cabinet is here to do. Again, this idea of like a manager, right? They're managing grant making, administration of funds, but they're also part of that management when it comes to the strategic planning process. So where are we at now? Where do we want to move going forward? What strategies can we use to get there? That's all within the cabinet's role. Also a connector. You're bringing together various stakeholders across issues in early childhood. That might be from the government, that might be from the public sector, nonprofits, and again, these community level groups that we can bring together and really move the work forward when it comes to sort of improving early childhood across the state. Obviously, one that I really enjoy about the cabinet is obviously this champion, right? The Children's Cabinet is doing nothing if not making sure that we all appreciate the importance of early childhood. And that includes investing in early childhood for the best possible outcomes. Strategist, obviously looking for those opportunities. We'll talk about a few opportunities that came up and that were taken advantage of during this past year as we go through some of the initiatives here coming up. And finally, evaluator, right? We're looking at how are we doing? How is the early childhood system in Kansas working? Where can improvements be made? How are our efforts working toward those improvements? And so using obviously some data-informed decision-making and some evaluation practices to really make sure that we're making the right recommendations to move the system forward. But what I want to point out here is that all of these roles are dependent on solid community level supports. every single one of these roles needs community level innovation and champions for us to be able to move this work forward. And again, I'm gonna highlight across all my slides today that this is really the work of communities and the work that many of you on this call are doing. So I really want to once again say how much we appreciate the efforts that you do that allow the cabinet to continue to push this work forward and get this work in front of the folks who can help us make those decisions. All right, Julia, we can go ahead and move forward one more slide. And this is just an overview slide here of the various initiatives that I pulled out that the cabinet administered over the course of 2024. Again, with the caveat, there are many other initiatives that are happening at the community level. I just pulled out several community-driven programs. Again, some that I know a little bit more about and can speak to, but I also want to acknowledge that there are many more things that are happening across the state, many more things just happening within the cabinet beyond just the ones that we're going to touch on here today. But these are the ones that we'll go through. So the first one will be the Children's Initiative Fund. We'll then get into the Early Childhood Block Grant, which is nested within that Children's Initiative Fund. Talk a little bit about some community-based child abuse prevention programs in the state. And then finally end with two of those interesting opportunities that I mentioned just a moment ago, and that is the Child Care Capacity Accelerator, as well as the Capital Project Fund. And those are some very interesting programs that we're able to utilize some funds for in this past year or so. And we'll talk a little bit about what those are and how they've been working in the community. Okay, if we want to advance one, we'll start with the Children's Initiative Fund. All right, this one is near and dear to my heart. It is one that I work on, and we'll begin the new process working on here as we move into the new year. Just a little bit of background, and this is, again, all this information on the slides that you're going to see here can be found in that previous presentation, but also will be found in the annual report when it's released. But just a little background on the Children's Initiative Fund. So the Children's Initiative Fund essentially was created in 1999, and it was the purpose of it was to take the investments that were coming to the state from the Tobacco Master Settlement Agreement and be able to focus those funds. In particular, it helped create the Children's Cabinet, which allowed those funds to be concentrated and focused on early childhood. Again, that's the idea behind it, where the money comes for this particular initiative and how we're able to use that money from year to year. So for this past year in 2024, the fund was able to fund essentially 10 different programs, and they do a variety of different things, all with a toehold in early childhood. So a couple of the areas we list here are early care and education, also early intervention, maltreatment prevention. You'll see that as a thread through a couple different initiatives, and then also tobacco use prevention as part of the Tobacco Master Settlement. That is certainly something that is a goal, is to try and reduce the use of tobacco products, certainly in children, but also in adults as well. The last two bullet points here talks a little bit about some of the various aspects of it. If you receive funds from the Tobacco Master Settlement via CIF, the Children's Initiative Fund, you are required to take part in what we call the accountability process. Essentially, this is a process that evaluates the use of funds for each program that receives those funds. And so every year they take part in the process. There are several different components of it. We ask them to just give us all of the reporting that they've done throughout the course of the year. Many of these programs are funded through multiple funding streams, and those other funding streams have their own evaluation requirements or reporting requirements. We simply ask that they give us those to us so we can review those as well. We also asked them to do essentially what is a survey about their program services to understand a little bit more about what they're doing and their reach. And then we have a fairly long interview process with each of the programs to talk in depth about the work that they are doing. And I will say part of that process is us asking them, how do they make sure that their programs are bringing in the voices of the community in which they serve, and in particular the families within those communities. So again, tying this all back to community-driven types initiative, that is something that we evaluate them on. Are you taking into account the folks that you are serving and making sure that those voices are heard and incorporated when it comes to programmatic decision making? In the annual report, what you'll find is a lot more information on each and every one of these particular programs. if you are so inclined, you could also go back to the June 2024 cabinet meeting, in which case you can hear a very long talk by me on each of these programs. I try not to go back so I don't have to hear my voice played back to me. I find that to be a little grating personally, but there is some great information in there as well. In that we review program descriptions, we talk about population served, and we highlight some of the impact data from those programs. So what is happening at the community level? What impacts can we see from that stream of funding? All right, Julia, if you want to move forward, I think our next slide is really just to illustrate where that funding goes and sort of also kind of look at the amount of funds that are available. And so as you can see, these Children's Initiative Fund actually distributes funds to multiple state agencies that they then put forth to various programming. That top one there is the Kansas Children's Cabinet and Trust Fund. So that's dollars that stay within the Children's Cabinet and that are used for specific programming. And I have a future slide that'll talk a little bit more in depth about that larger one there, the Early Childhood Block Grant. But the cabinet also distributes the funds to KSDE, the Department of Education, the Department of Health and Environment, as well as the Department for Children and Families. And just to note, you can see the total funding amount up there. All of this money that is able to be used for this particular project currently comes from that Tobacco Master Settlement Agreement. It goes through a couple steps before it actually gets into the CIF, but all of that money comes from the Tobacco Master Settlement Agreement. And so that amount is actually variable from year to year. It all depends on the amount of tobacco sales within the state of Kansas. And so based on an equation on the percentage of sales, it can go up or down. And so it can fluctuate, meaning that the total money that can get to the CIF at some point will also vary from year to year. I also should note that because of the way that this program is set up, the cabinet actually makes recommendations on funding for the programs that it currently funds or for future programs, but those are actually set during the budget process. So in I guess, combination or collaboration between the executive branch and the legislative branch when it comes to budgeting. So these are actually line items in a budget and therefore are set at the end of the day by the governor and the legislature. All right, if we want to move forward one. Okay, so let's just talk about what we heard this year during the accountability process. What did we hear from the grantees when it came to what's happening in the communities they serve? You can see the first one there. It's about supporting families, and that is that CIF programs do continue to provide essential services and supports for the healthy development of Kansas children and families. And we see evidence of those benefits when we talk to the grantees. But beyond that, we see it in the performance metrics that they report to us. So those pieces of impact that you might see if you go to the report, or the annual report, excuse me. But we also get direct family via the programs. We get direct family feedback about how important those programs are. And over again, we hear about how appreciative families are to be able to receive the types of support that they can because those programs exist. And part of the reason they exist is because they are funded via the Children's Initiative Fund. The other thing that we see is that the Children's Initiative Fund allows for an increase in impact. So all of the programs that are funded via the Children's Initiative Fund utilize multiple funding streams. And in some programs, actually CIF funds allows them to pull extra funding down from the federal government to be able to extend their impact. But in each case, none of the programs will be able to serve as many communities or as many people, children, and families had they not been able to receive CIF funds. So we think it's really important to highlight how this particular fund can increase impact within communities. A couple things that we're seeing as far as like additional needs that are happening from our programs and from the families they serve is this one around basic needs. I don't know that this one will come as a surprise to many folks, but CIF funded programs connect to families and they provide additional supports and families remain resilient. But they still struggle. They still report struggling with basic needs. And what we see happening is that when families continue to struggle, it really blunts the impact of the services that our programs can provide. When a family still needs to worry about where basic needs are going to come from, it can be harder for them to invest more fully into the services that are coming to them and their families. So I wanted to highlight that. We also see across the state that staffing for our programs continues to be a struggle. It's hard to both find staff, but also retain staff. One of the things that we hear about is that because of the level of funding that is available, wages are an impediment sometimes to being able to continue to have the adequate staff to run the program. So again, that might not be a surprise to many of us on the phone call, but it is something that we continue to highlight when we go through the Children's Initiative Fund accountability process. And then finally, we see, and this is, I think since I've done this for several years, this has been one that's developed more in the recent years than potentially I bubbled up in the past during my participation in the process. And that is there is an additional need for mental and behavioral health supports and resources. And this isn't just at the service level for children. It's also seen in the families that those children, but also it's also seen for service providers. So our program staffing and the providers, they themselves are also looking for and benefiting from if they can get them additional mental health supports and behavioral health supports. So wanted to highlight that as well. All right, if we move forward one more, Julia, thank you very much. So here's where we're going to jump into that one particular program that I highlighted when we saw the funding chart, and that is the Early Childhood Block Grant. And you can see here, it's what we are calling one of the signature CIF investments. And the reason for that is this is one of those programs that is directly administered by the Children's Cabinet. Its main goal is to provide services to children birth through 5, in particular those identified as at risk, and to provide services to their families as well. I want to note that ECBG funded programs are community focused. So each ECBG funded program talks about the community that they are going to provide services and the needs of that community. So again, it's a community driven process where they determine what is needed at the community level, and ECBG can provide funding to help provide those services. And in that way, they are responsive, more readily responsive to local needs. Just as you can see there, those ECBG funded programs this year served over 8,000 children and almost 7,000 caregivers. And that was across the 63 counties that you can see there on the screen. So it's a big spread of these services that are being able to be provided across the state. And we're seeing some positive outcomes from those services. So we can just move forward one more slide. We'll talk a little bit about some of those positive outcomes. All right. So I do want to also, as I want to make sure I give credit where credit is due at all times, these evaluation highlights and takeaways here are the product of a team at Wichita State University led by Lynn Schrepferman. And if you would like to see more details on this, one more plug for the Cabinet website. The October Cabinet meeting, Lynn gave a extensive presentation on ECBG, what its purpose is, and a lot of highlights when it comes to the various components of ECBG and the outcomes in particular. I think that are always interesting every year to understand a little bit about the impacts that you're seeing from this funding stream. As you can see, some of the increases to highlight there, participation in the program sees a 17% increase in positive parenting. When it comes to look at the classroom quality, 78% of the classrooms that we see are high quality classrooms in the course of the evaluation process across the course of that school year. Some very positive child outcomes. We see 75% are on track in early communication, 59% on track in early literacy, 70% on track in language comprehension, and 68% on track in early numeracy. And again, I want to highlight that these are great and positive outcomes, but they also, again, are positive outcomes that are the product of the work that is happening at the community level. So these ECBG recipients are the ones that are putting in the effort. The Cabinet is providing additional supports. And so obviously, Dr. Schrepferman and her colleagues meet with these grantees and make sure that they have the supports that they need to make the progress that they're hoping to make. So this is some great outcomes, again, driven from the community level participation in these programs. All right, I think if we move forward, we're ready for, yes, CBCAP, community-based child abuse prevention. Yeah, there we go. lovingly referred to as CBCAP. This particular program is a federally funded program. So this is a program that comes direct from the federal government to the Children's Cabinet to be administered to grantees across the state. So the Children's Cabinet is the lead agency. Just to note, this particular year, 2024, there was additional funds that were available via the American Rescue Plan. And so this year it was just over $2 million that was able to be spread out across the grantees. That was included 11 different grantees, and they can offer an array of services. And again, this is because it really is about a community-driven initiative for CBCAP programs. These programs self-identify what interventions are needed in their community, and then the CBCAP funds are allowed them to go ahead and provide that type of service in their community. So 11 grantees. The array of service this year included parent education programs, home visiting, some case management, and also some preventative legal services, as well as resource centers for families. All right, if we advance one more, we'll talk a little bit about the evaluation results as far as CBCAP goes. One of their measures, I should mention that the ECBG grantees previously have a host of common measures. That's where we saw that outcome data come from. But CBCAP also has a measure that is used across grantees, and that's the Protective Factors Survey. All right. Make sure I got my notes queued up. The Protective Factors Survey, as you can see here on the screen, there are several positive results here. We see 30% growth in family functioning and resilience, 8% growth in the subcategory of growth in nurturing and attainment. Social supports, you can see another large growth there of 30%, as well as 11% growth in caregiver and practitioner relationships. I do want to pause here for a second and note that these programs also provide a lot of concrete support. So we see increases in that particular subscale as well when it comes to CBCAP grantees. And then I think one of the really important findings about CBCAP is that some of the access to supports really do increase a positive correlation with enhancements on the protective factors, but also really help the ultimate outcome, which is services resulting in fewer removals to the foster care system. And that is what we see with CBCAP grantees. I should note that we also see that with ECBG grantees. I don't have a slide on it just for time's sake, but in the annual report, if you go through that, you will see that, that there had been a project that was looking into foster care or removals from the home and participation in ECBG. And what they found, I should say, is that ECBG also impacts this. And in fact, we are seeing fewer kids that are needed to be removed if they are able to participate in ECBG services. And they were also able to quantify that cost savings that is to the state simply from participation in ECBG services. So I highly suggest checking out that section of the report. I believe it's in the area called Data for Impact. So please feel free to either watch that presentation or check out the report when it is released. Okay, I think our next two are kind of grouped together here on this first slide, but that is the Child Care Capacity Accelerator and then the Capital Project Fund. And so what you'll see here on your screen is a couple of things. This is the spread of those particular funding sources. So Child Care Capacity Accelerator and Capital Project Fund, I'm going to call that CPF from here on out. But you can see both their spread. So you can see we have a decent amount of spread across the state as far as the communities or sites that were awarded these funds across the year. And you can see a little bit about some of the services they are offering, but we'll talk a little bit more about that. So you can see where there are Capacity Accelerator grantees versus CPF grantees. But both of these programs, the purpose was to invest in early childcare businesses, in particular startup costs to accelerate childcare capacity throughout the state. So the ultimate goal is to increase capacity across the state to provide care during the early childhood years. The Capacity Accelerator strengthens community capacity to provide childcare. CPF in particular was looking to build and renovate community spaces to meet childcare and other basic needs. So we'll talk a little bit about that when we get to that particular slide. But once again, here what we see is that these were proposals that came in and were awarded grants, and as part of that, they really needed to be able to emphasize community-driven solutions. So what they would do is talk a little bit about what is happening in their community, what is the need for childcare, and how does their particular project provide a solution to increased capacity for that community. I should say that because of the type of funding that this is, and the ability to use it to potentially create and renovate or elevate infrastructure in their community, these really are, well, one-time funding projects. They really do provide generational investment in that community, right? Because if you're building a new childcare facility, that facility is there. It is not that it is, after the year funding goes away and the childcare facility goes away. No, it's there. It provides the startup and the ability to then move forward, continuing to accelerate and increase that capacity, and then to keep that capacity into the years moving forward. And so one of the things that you also will probably see there is that we have a couple groups of innovation communities. And one of the things that we really found throughout this process is that local communities really are the driver of innovation and practical solutions when it comes to their local area. So they know their community, they know the type of work that they'd like to do or needs to be done, and they're the ones that help us find and fund innovative solutions to help move the work forward and increase capacity and availability of childcare. All right, if you'd move forward one more, just a couple highlights from the the first year of the accelerator. There was an evaluation report that was interestingly enough, also reported at a children's cabinet meeting, and that would have been the October 2024 meeting as well. And so just some highlights of what we saw as far as this first year of accelerator projects. And so accelerator grants were distributed to 63 different communities. Just a little breakdown of what that looks like. 36 of those were located in rural parts of the state. So again, I want to emphasize that we are, via this funding stream, making sure that we are meeting various types of communities and in various communities across the state. Something I think that is fantastic is in this first year, we have already, I keep saying I should not be taking credit for the hard work of the communities. Over the course of the first year, those 63 communities have already created 23 new facilities for childcare, and that is across 20 different counties in Kansas. So we are seeing new facilities, renovated facilities going up and opening their doors, increasing capacity for early childhood care in those communities. As such, we have already seen 3,340 new licensed childcare slots created during that first year. And so we're already halfway there to our goal. Many of these programs continue on and will, over the course of this year and the following year, continue to produce new slots as their projects open their doors. So when it's all said and done, we expect there to be at least 5,655 new licensed childcare slots across the state. Another thing that I'm really happy to highlight is that these projects have also contributed to the hiring of 448 new childcare staff. So that's, again, job creation within those communities, new staff coming in to the field, providing that capacity to be able to increase the availability of childcare in their community. And then one other thing I did want to note, I mentioned this on some of the previous projects as well. This did have a matching requirement, and I'm happy to say that it was able to establish 58 million in matching cash or in-kind funds. So they were actually able to go over that to more than double the amount of funds that were available in those communities to produce these childcare slots. So really good work from the communities. Part of the process of getting the grant was to, in some sense, establish and prove your community connections and the community partners that we're going to be able to come together, both in the matching funds, but also in just providing that community connection to make sure that the needs of the community were met. All right, I think we can move forward one now. All right. And I think this is the last, this is the last initiative that I'm going to highlight. And this is one that has kind of just recently gotten, I guess, its full momentum going. And this is the Capital Projects Fund, or you'll hear it called CPF quite often. And this is 10 different unique projects across the state. As I said, many of them are just getting underway. But it provides construction-only funding to build and renovate multi-purpose community facilities. And so some of the things that they need to build into those are the ability to provide work and educational activities to help community members search for and engage in employment or develop skills and knowledge to become employed. To ensure immediate broadband access to the community members for at least 5 years. We know that that's a really important thing that we've seen across the state for many years, is the ability to be able to access the internet, and in particular, a broadband high-speed internet. They also offer health monitoring services for community members. And so that includes both physical and behavioral health. So looking at some of those health monitoring services. They're also addressing critical needs resulting from the COVID-19 public health emergency. These funds come from relief effort funds, and so that makes sense that is one of the things that they should be interested in, is to make sure that those funds are spent in a way that helps, again, address some of those needs that were exacerbated during the pandemic. And finally, I'm not going to say most importantly, but important for this group, they were to create new licensed childcare slots, providing quality care and education and enabling parents and caregivers, children birth to 5, to participate in employment opportunities. So these were funds that really were directed at larger scale community projects. That's why there were fewer of them, but they are off and running now, and we can't wait to follow them along and do some evaluation about how their community-driven programs are successful. And so with that, I'm going to pause. I know I've talked a lot and fairly fast at you all, and I think we can go to the next slide, which is just my questions slide.
Yes, if anybody has any questions, feel free to come off mute and ask. You can also utilize the chat as well. Oops, did not mean to do that. Jumped ahead.
Yeah, and Julie, I'm not seeing anything come through yet, but I do want to sort of
Yeah.
echo Melissa's opening comments and just say a big thank you to everyone that's taking part in this webinar and these initiatives, but also to folks that are just doing some solid work around the state. I think that 2024 has been quite a year, and I'm really excited to see how that sort of trickles into 2025 and what else we can accomplish.
And Owen, I thank you for the comprehensive overview. I would say the team at CPPR is putting the finishing touches on the version of the report adopted by the cabinet at our board meeting on Friday. Once all the final adjustments are made and we lock down the draft, it will be posted on our website as the 2024 annual report, which we make publicly available. We provide to anyone interested. So the whole thing is out there in draft form. The cabinet added some final policy recommendations that we're working to embed in the final document. So thank you.
Thank you. Last call for just any questions or clarification or anything from Owen or Melissa before we move into our early childhood systems updates. Just some people in the chat excited to hear about the great early childhood work that's being done throughout Kansas. All right, well, I'm going to move on forward with the early childhood systems updates. And first is some very exciting news for Kansas, and that is the preschool development grant. The Preschool Development Grant is a federal grant program that supports states and territories in improving their early childhood systems by providing funding to enhance access to high quality early care and education for children birth to age 5. And Kansas was one of 10 states that were awarded this year that preschool development grant. The Children's Cabinet and Trust Fund is the official grantee of that grant, and it is approximately $7 million per year that is anticipated that will come to the state of Kansas to enhance our early childhood systems. And on the next slide, I'm going to talk a little bit about kind of what categories those grant initiatives fall under. But this grant is a 3-year grant, so it runs from September 30th of this year through September 29th of 2027. And this is Kansas's 4th PDG award. So the PDG funding specifically supports strengthening early childhood systems. And in Kansas, these efforts are guided by the All In for Kansas Kids strategic plan. So a couple of those, well, all of the grant initiatives, all of the PDG projects that are covered by the grant will fall into one of the following categories. So we are working on strengthening the All In for Kansas Kids system knowledge, collaboration, and communication. We want to enhance the early childhood workforce. Some projects are in reference to family resources and navigation, and then also promoting state-local partnerships and community collaboration. So I'm sure as the years progress, you will hear more about some of those specific projects that are being funded through that preschool development grant. But it is very exciting news that Kansas is receiving over the next 3 years, $21 million from the federal government. Next, we have the Brazelton Touchpoint Center, which is a national child development center based at Boston Children's Hospital that is providing professional and leadership development, organizational learning and change, and research and evaluation services for family-facing professionals working in pediatrics, early childhood care and education, infant mental health, children's libraries and museums, home visiting, early intervention, child welfare, as well as some other fields. So Brazelton offers free opportunities for families to connect through open conversations that run year-round. A few of those family conversations are linked on the slide, and Bree will drop those into the chat for you. They have family to family real talk series. They have a Somos Latin families conversation, as well as communities strengthening themselves. So all of those links are going to be placed in the chat by Bree, and you can also check out Brazelton's learning catalog, where you can browse by audience, conversation, or topic. So just some really amazing free child development information online through the Boston Children's Hospital. Next is a home visiting work group. So calling for the help of individuals that are interested in the home visiting workforce development. So the Institute for Home Visiting Workforce Development is looking for individuals in the home visiting field to participate in a work group to inform their research and evaluation efforts. So if you have worked in home visiting for at least 1 year, you would be eligible to participate in this work group. Work group members will receive an honorarium for their preparation and participation in virtual meetings. So that first bullet just kind of lists all of the individuals that could participate. So the work group will include home visitors, home visiting supervisors, program managers and directors, state, territory, and tribal home visiting leads, technical assistants and professional development providers, as well as researchers and evaluators. So if you are involved in the home visiting field and have been for at least a year and are interested in participating in the workforce development of the home visiting work group, you can complete the brief interest form. I have a question in the chat about where can we get more information about the preschool development grant. Scott, I would say sign up for that All In for Kansas Kids e-newsletter. If there is anything kind of in relation to that preschool development grant or any public facing information, that would probably be the first place that would be a good place to look. And then we have the health insurance marketplace. So a reminder that open enrollment is happening currently and through January 15th. So the Administration for Children and Families has partnered with the Centers for Medicare and Medicaid Services to spread the word about open enrollment to the early care and education workforce who may be eligible for quality, low-cost healthcare plans through the healthcare marketplace. Family childcare providers and staff in other early care and education settings may qualify for tax credits and other benefits that millions of Americans are eligible for due to the Inflation Reduction Act and the American Rescue Plan. Now is the perfect time for early care and education staff to find out what they may qualify for, compare health insurance plans, and potentially enroll in health coverage. So all plans cover essential benefits such as primary care, prescriptions, and emergency care, and are affordable with 80% of enrollees eligible for plans at $10 a month or less. So if you would like to find out more, you can follow the link in the chat that will bring you to that healthcare marketplace where you can compare and evaluate if there is a plan that would potentially be beneficial to you. Reminders and next steps. Our early childhood recommendations panel meeting is being held next Friday, December 20th from 9 to 11:30 a.m. This meeting will be live streamed on the Children's Cabinet YouTube channel. Reminder that our next early childhood systems building webinar will not be until February 12th, since we are taking the month of January off. But please remember, as I stated earlier in the webinar, to be on the lookout for an email from Zoom that will give you the opportunity to get the new series, the 2025 webinar series, onto your calendars. And the next Children's Cabinet meeting is also not until Friday, February 7th from 9 to noon. So as always, you can find recordings of these meetings or you can watch the live streams happening on the Children's Cabinet YouTube channel. And to stay up to date, you can subscribe to the YouTube channel. You can sign up for that All In for Kansas Kids e-newsletter. And you can follow us on X, formerly known as Twitter, for all updates. But we want to thank you so much for coming today to listen to our presentation from Owen. And thank you to Melissa for coming and extending her gratitude to all of you in Kansas on the ground, boots on the ground, working hard for childcare in Kansas. We appreciate you all, and we hope you have a very happy holiday, and we will see you next year.